You are tuned in to The Local Lens, the podcast from the Powell County Health Department and Kentucky Rio, where we go inside our community's experience with the drug epidemic. Our show is coming to you from Stanton, Kentucky, a small town nestled at the foothills of Appalachia. And the whole goal of this show is to find as many different perspectives around addiction and the overdose epidemic as we possibly can, compile all those perspectives down into this one place, and hopefully we'll be able to see addiction a little more clearer and be able to see more details about what addiction is actually like after seeing it from all of these different perspectives. Because if we know what we're facing better, then we'll be able to address it better. And in this episode, we're going to be taking a look at jail education programs. We are looking at a women's jail in Montgomery County, and we're going to be looking at what jail is like for people, what happens in the jail as far as education and self-help kind of stuff goes, and then we're going to be looking at what the shortfallings are and what could be done better and what is being done to hopefully make it better. This is also part one of a two-part conversation with these two same ladies. We couldn't fit it all into one 30-minute time slot for the radio, so we're going to split it up into two, so we're not cutting you all short of any of the information we're getting from them. So let's go on and meet these ladies then.
I am Gregory with the Montgomery County Health Department, and I work with our jail education program.
And I'm April Smith. I work for UK Healthcare as a health education coordinator / risk reduction specialist, and I'm housed here at the Montgomery County Health Department.
You and April work together?
We have for about 4 years now, but as far as the jail education grant and harm reduction and things like that, we've been doing that together for about
a year and a half.
About a year and a half, 2 years, something like that.
All right, well, let's go on and get into it then. I'm your host, Nate Brooks. You're listening to The Local Lens. These are our people using our voices, telling our stories, because no one sees it like we do. What does your job look like?
My job, we only were working with the female population. When we were up and running smoothly, we would go in twice a week. I would do individual interviews with each of the ladies, just kind of get a feel of how they were, where they were, what needs that they had, if it was needs for themselves, their children, the families that were taking care of their children, just different things to try to find out, where they were in their, I don't want to say the word journey, but where they were at that particular moment and what they felt like was important for them. And April would go in, and April did some different classes with the ladies. And
we spoke on STDs and sexual health and
yes.
education.
Yes.
And then I did chair yoga
yes.
with them a few times, and they really responded to that. That was really rewarding, I think, and really neat. And I don't know if you mentioned, but the grant is an OD2A grant.
Yes.
So the population that we're working with are there on drug-related charges. You may have a better way of saying that. Am I saying that right?
You are. I mean, we don't exclude anyone, but that is who the grant is geared towards. Okay. Is people that are there for drug charges and drug addiction and things like that.
Which we know 85%
yes.
or better of the population that applies to, wouldn't you say?
It really does. Yes, it does.
Okay.
It really does.
That's exactly what we hear in Powell, too. That's what everybody, pretty much anywhere in this region has said.
Mm-hmm.
About how long do you have contact with individuals when you're in there?
It just depends on their sentence. I mean, I have actually spent 2 years with some of the ladies that I have met there. And then we continue, if they are released from the jail, we continue what relationship we have. If they choose to stay in contact with me, we continue that. One girl now I've been with for almost 4 years.
Yeah.
Because I had met her at the beginning of our grant. I said that April and I'd worked together about 2 years, but this is our third year with the grant. But I had met her prior to that. So, I follow them as long as they want to stay in contact with me and things like that. I have no problem with always helping them. I had a gentleman come in the other day with another program that was 8 years ago, and he still pops in and I still help him with whatever it is that he needs to. So
Nice.
there's not a set time.
Way back in our catalog, you can find an episode that we recorded with Brad Epperson, who is a preacher from Powell County who also works in a similar role in the jail as these ladies do. So one of the big things we talked about with Brad was how the men's jail operates and how the men react to things. So I was curious heading into this conversation how April and Angie see their interactions with women who are in jail for drug charges. What's it like, though, working with women who are in because of drug charges?
There's a lot of trauma.
I started to say the biggest thing I've noticed is the trauma. They're broken. Their histories are very sad, and it goes back to childhood. Most of it goes back to childhood, the ones that I have dealt with. And I think I don't know how to explain how they come to where they are. It's just about coping or feeling numb, how they end up where they end in the situations that they end up in.
And like, for instance, when I did go in with the chair yoga, which I think I was only able to do that maybe 2 or 3 times, I didn't know how, what the reaction would be because, with chair yoga, you sit there and you breathe and you do all these very measured and slow movements. And I thought, are they going to think this is silly? How's it going to go over? But they were like in it, like they were so engaged.
I really believe they were. They seemed to enjoy it so much. It was just a little bit of self-care, and I don't think it's anything that they've ever focused on in their entire lives. I really don't.
Yeah.
We had a speaker, the Lisa Coffey, that came, and she spoke.
She did the effect of addiction on the brain.
Yes.
The actual physical effect. And she was able to go into deep detail about how it affects each part of the brain and all of that. And they were so engaged and so interested. And, I don't want to say the wrong thing, but I think there's this perception of they don't care. That's far from the truth. They do care, and they want to take care of themselves.
They do.
They just often don't have the opportunity.
No.
Because they're more in survival mode.
Yes, once they leave the jail, their situation completely changes again. That world that they lived in prior to going to jail, they're right back in it. And so their whole mindset kind of changes again. And like she says, it's survival mode. That's what they're dealing with, is that, and not when they're in jail and they've had an opportunity to not use for a while and to think about themselves and their situation, they are more willing to learn, and they want to learn, and they want to do better.
And a lot of them, going back to Lisa's presentation, she was talking about addiction in the brain, but even her explaining this is why some of these behaviors take place. We saw a lot of emotional reactions, didn't we? Because there were like light bulb moments, and the ladies were making those connections within themselves. I think maybe for the first time, thinking, hey, this is a whole aspect of it that maybe I've never considered before.
I've never thought about before.
Is, the drugs going into my body over a prolonged period of time is affecting my thinking and how I relate to people and even my behavior. And not that it's an excuse, but it's a connection to the whys of it all. And I think that's so important.
In a lot of ways, when people are in jail is one of the most possible times for them to really start opening their eyes with a sober view and start seeing their life as what it is and seeing their needs for what they are. And there are a lot of ways to put that effort in, and one of those ways is a peer support specialist. And those are people who are in long-term recovery themselves, and then they've been trained, and their job is to help other people work through their recoveries.
We've been very fortunate, too, to be able to partner with Pathways, which is our regional prevention center, and they have provided peer support.
Yes, they have.
And she comes in to lead a group.
So she is also someone that they can identify with, I think, at the jail. And I just think that makes a huge difference when it's somebody that they feel like has been in the same situation and experienced the same things.
Because she was in that very jail.
Yes, she was
pregnant,
there too. Yes.
Yes, a few years ago.
Yes.
So now she's got that story of coming out,
Mm-hmm.
you know, starting over with a husband and growing her family, and now she works for Pathways. So it's really an inspiring story.
And having that perspective is incredibly important because unless you've been there, unless you've walked that path, then you don't know what you're talking about.
The whole jail thing, I mean, when you're talking about this, when they were thinking in the beginning, you just have no history or no idea as to what you're really stepping into. So once you got in there, you had a much better idea of what was needed, and so they did expand and continue.
Which, for the record, that's exactly how I felt coming into this interview. Like, I have no idea what happens in the jail.
Mm-hmm.
So it's like, just within those walls, there's a huge mystery to people outside. And I wonder if what happens inside of jails is much different or similar to, like, the perceptions I have. And I don't even really know what the perceptions I have for it are. But what's it like in there? Is life comfortable for people in jail?
No, there's nothing comfortable about that life
No.
at all. Actually, to me, it's I can't even describe it. It's not anything that I had ever thought. I mean, even as television portrays things, it's not
Very different.
It is very different, and actually, when you walk away from it, you feel just really sad.
There's a heaviness, and I think there's not much freedom. I mean, obviously you're not supposed to have freedom in jail, right? But I think what we see on TV, there's more freedom than in real life.
Oh yes, because you think of this common area where everybody hangs out and plays cards and things like that. I mean,
and there's established libraries and stuff like that. That's not what we see.
That's not what you see at all. I mean, inside their cells, which the cell may hold 15 people or 20 or, I mean, it's overcrowded, that's for sure. Within that group, you see people socializing and maybe playing cards or whatever activities it is that they're doing. But they're in a cold, dark, there's no windows, just a block room, that's what it is, with metal bunk beds, and the ones that are lucky enough to have a bed, they're there, but the others that come in later with the overcrowding, I mean, they have this
a rubber mat.
It's a rubber mat. It reminds me of a shoe sole or something that you would lay on, and that's what they lay on the floor.
And a lot of them are in withdrawals and detox.
Yes, and they're sick.
And we want to preface all this by saying, I mean, the jail has been absolutely wonderful.
Yes, they have.
Welcoming
That's what
us in, and we have nothing but respect for the jailer, for the workers there. We're not pointing fingers.
No,
it's just the nature of it.
Yes. It's that's
and
just,
they want what's best for the people in there. I mean, they've been really like just about everything we've asked for. Can we do this? Can we do that? They've said yes. Come on in. But COVID has stopped a lot of that, unfortunately.
It has, and their hands are tied as far as letting us back in and things like that, and what rules that they have to abide by. But no, the jail staff has been wonderful.
Yes.
I mean, like she said, and that's one of the things I was kind of concerned about saying anything about it, because I didn't want it to seem like it was them, because it isn't.
The rule is that they can't exercise or do anything like that. That's a privilege that they don't even get to have. Like, they're not allowed to do any of that at all. And I just thought about that whenever you all were talking about things that they don't have in the jail. Like, the movies and stuff like that portrays them. They can go outside and exercise and run or lift weights and stuff like that. They're not allowed to do that.
No, we don't have those facilities here. But I know when they're in their cells, they are so crowded. I mean, most of the time you're just sitting on your bed. And even when they bring their lunch, they come to the door, they open it, and they come and get their trays. They eat on. I mean, everything they do during the day is while sitting on these beds. I mean, there's just not any activities for them at all. But they have really no personal time for them to take better care of themselves. You know, while you're there, you're in this one situation, and every day is the same. And I realize that's what people say. Well, they're in jail, and that's what they should be doing. But it's just a very depressing situation.
When you first walk in there and those big metal doors cling behind you, it's intimidating. But you get used to it a little bit over time.
Well, I do, because then I'm leaving. I mean, I'm not going to stay. So
Yeah, you're leaving. We're there
leaving
for an hour or two, and then we get to go home.
Mm-hmm.
That's how I feel about babysitting. Just for the record. I've used that same exact thing. I'm fine with it because I know
I'm leaving.
Get to leave.
Yes.
So time in jail is not fun. Nobody expects it to be fun. But it is a place where, if you're concerned with getting people into recovery, it is a place where people are all located at one place. It's a place where people have to stay still long enough for you to be able to actually reach them. And these two ladies are concerned with keeping up with those connections after their release from jail.
One of the biggest hurdles is catching them when they're released, because we don't know when they're going to be released. And then, do they have an active phone number? It's so hard, and that's been your biggest barrier, wouldn't you say?
It is a barrier that I list actually every month on my report as one of the things that, we've not been able to change or find a solution to. The jail says they are not made aware in advance that people are going to be released. They don't follow them after they're released. I mean, I'll say, well, what? You say it was a rehab facility. What rehab? They don't know what rehab. When they are released from jail, they don't have a current number, or they don't know who picked them up. Anything. So they're just releasing these people to what, like I said earlier, to the same situations that they've left earlier. So if we were just able to talk to them a few days prior to being released, we could help a whole lot, offer a lot of information and get something current to where we could, keep that contact going. But that's just not there, because they are saying they have no prior knowledge to the release. It's like the call comes down, or the paperwork or whatever,
and then they're gone. You can
is very
imagine
odd.
the frustration behind it, because part of Angie's responsibility is follow-up. But how can you follow up if you can't get in touch? Mm-hmm. And, that's part of the system that we feel like probably needs some attention.
It does. It does need attention. I mean, we have them fill out a lot of information when they start our program, addresses and contact people and phone numbers, but 6 months, even if it's just 2 months later, all that information can be completely different. So we have nothing current, and the jail has no way of giving us any current information either, because, as soon as they are no longer their responsibility, they're out the door.
And as many people that we've had on this podcast have done, these ladies found some kind of solution and put it to action.
What we've done with our grant is once the ladies are released from the jail, if they will contact me, we have been able to purchase cell phones for them. And as long as they contact me twice a month, we will continue to purchase minutes for them for up to 6 months after they're released from jail.
That is very, very, very cool.
Mm-hmm.
That is that's a good idea. Whose idea was that?
It's my idea, of course.
Yeah, there it is. That's a great idea for so many reasons.
Uh-huh.
Yeah.
Well, that was just an incentive. Hey, if we can't get in touch with them after they're released, we can't do the things that we want to do for them. So the cell phone is a big incentive.
That's a huge incentive. Yeah.
So, and to say you have this card waiting on you, if you'll just give Angie a call or meet her,
And then guess
Twice a
what?
month.
She's
Yes.
got their number.
Yes, I
so
also
she
have
can
their
follow
phone.
up.
Yeah.
And another thing we've been able to do, and it's still getting off the ground, but we wrote in a $1,000 mini grant within the ASAP grant for public transportation. And if they use the code word ASAP, they can get free transportation. And now, right now it's only running on Monday, Wednesday, and Friday, and we're still getting that word out, but that's something. So if they need to go to a meeting or a doctor's appointment or even to the grocery store, they can utilize that program.
How available is public transportation here?
It's not very. I will say that it's getting off the ground, and
Ours is new.
Ours is new, and Gateway has made great strides. They've implemented a Monday, Wednesday, Friday shuttle, and they will take you anywhere in the county, $1 one way, which is very affordable.
Yeah.
But you do
Yes.
have to call, I think, 24 hours in advance.
Yes, I know
But-
that you do have scheduled.
Yeah.
ahead.
So they hope to expand that to in the future to a full week, and maybe even make like a thing where it has stops, like what you would see in more of an urban setting, where like they would have maybe a regular stop would be, say, Walmart, because a lot of people go there. So that's hopefully on the horizon. Right now it is Monday, Wednesday, Friday with a reservation. $1 one way,
That's
which
very cool too.
it's yes, we're
It
very
is.
excited about
Yeah.
that. That's been a wonderful help.
It's been a little over a year since they've had that service.
Well, with the new infrastructure bill, hopefully that can be expanded in our county.
Fingers crossed on that
Yes.
one too,
Yeah,
right?
because that's a huge part of the infrastructure bill that was just passed has to do with public transportation.
Yeah.
So hopefully that could.
Which is such a huge need in like all the rural areas.
Yeah.
Yes.
Yeah.
We see some of it covered with like the medical transport, but then there's still other needs, like if somebody's in early recovery and they just need to go to the store, you know, that is a need right there. And we, you know, instead of them calling up somebody that may not be safe to take them to the store, they can call up public transportation.
So you was talking about programs and programs that they would ask for. Does anybody ask for like financial classes and just different classes, like lifestyle classes, basically? So when they're released.
Well, that is actually something that we've all suggested is life skills classes and things like that.
Cooking, financial literacy.
Yes,
Yeah.
We've suggested all that, and cooking is one of the things that I really want to get involved with at the jail. Cooking classes. We are doing a food handler's certificate for anyone that's there. We are paying for them to get their certification, so they're
And you've gotten
at
several.
least yes. So at
So,
least several
yeah.
of them have. I mean, they're job ready as soon as they leave the jail, with at least a food handler's certificate. But some of them have asked for that. But that is something that we would like to have incorporated in what we do. I think it's very important, because some people, you would be surprised, just have no knowledge of cooking, how to budget money, how to.
They're in survival mode.
They
Yeah,
are
so-
the entire time that, you know.
That was just something like we've been seeing more of a need for that.
Mhm.
And I just wanted, like, do they ask for it?
There has been several that have asked for that, but the one thing that really, the one girl that I've been working with so long, and she's doing great, is our GED, and she cannot pass these 2 tests on her GED, and she's really worked hard, and I just find that, you know, it bothers me that she can't. But some of these women have been in survival mode since they were children. School was not
A priority.
at all. So, I mean, when you're talking about taking a GED test and things like that, these people have very limited reading skills at all. Math skills are really sometimes non-existent, other than your most basic of math. They really need tutoring. I mean, I know we have adult education and things like that, but we really need someone to go in and do classes and work with a lot of them on their GED, just to get them prepared to take it. And it's going to take, I think a retired teacher would be something fabulous to see go in there and work with them.
Yes,
because
so if there's a retired teacher out
Yeah.
there looking to go
Yes.
and do some kind of service project, we need you.
Yes, the GED is a pretty difficult test, and just the few hours that they get with adult education is not going to make up for what they missed an entire 12 years during school. So, I mean, the GED program, and that is what they really, because they'll pass so many tests, but then they just can't get that.
And I'm so glad you brought that up, because I kept thinking about it. And we did have a connection at the adult education program, and then he retired.
Yes,
and then
he
COVID
did.
came in, and so we really haven't been able to kind of cross that barrier yet. So that's another area we are working on, for sure.
It is.
So we are nearing the end of this episode, but we are going to be having part 2 of this conversation as our next episode, so be sure you come back for that. But for now, we're going to leave you with these final thoughts.
I would just like to leave people with this thought that if you know somebody that's struggling with addiction, maybe a friend or a family member, just look for ways to be a friend to them, because you may be able to support them in ways that are unexpected. And I think it's important to set healthy boundaries and to use wisdom, but at the same time, don't just close yourself off. Look for ways that you can support them, because you may be surprised at how you can help them in the recovery.
That's kind of where I was thinking, is that if people would just open themselves up a little bit to look at addiction or people struggling with that differently and see a way that they can help. And I think a lot of people just look at it so harshly, and they're not looking at the whole situation. So if people could just, be more open-minded about it and think, is there a way that I could help them? If it's coming to the jail to help teach reading, or if it's just to be a friend to them, or whatever, I think that would make a huge, big difference in our community and any other community if we were just willing to be more helpful to the people that we see that really need help. I don't think they're in the situation that they're in because that's where they want to be. I don't think anybody wants to be where these people are. I don't. So, and I try to treat them as I would anybody. I really do. I try to help them as much as I can, and to look at them and offer my support whatever way that I can through my job, and personally afterwards when this is all finished. So.
And that is all the time that we have today. It's so good to be able to look inside the jail, where we have heard so many of our guests say how important that time was on their own recoveries. So it's really good to get to see on the other end of it the people who are trying to help reach those people. And I think it's important as a listener of this show to piece this episode together with those stories of people in recovery, and also with the stories from the police, so that we see how it all works together. It's a big system. And then when people leave jail, they go on to find places that are going to offer more treatment after they're released. It's all working together, and hopefully this will lead somewhere good. Anyways, thank you, April and Angie, for being on the show with us. We really appreciate it. Thank you to WSKV for broadcasting our show, and big thanks to the Powell County Health Department in Kentucky Rio for letting there be a show. This is The Local Lens. I'm your host, Nate Brooks. These are our people, using our voices, telling our stories, because no one sees it like we do.